In this fourth part of the four-part series, we're going to take a look at some of the evidence that exists for looking at the effects of acupuncture. And I've tried to focus my attention on some of the meta-analyses that have been done on this subject. And I'll highlight a few areas at the end where we have certain clinical indications where that are commonly used areas of acupuncture to look at, what the strength of evidence is for each of those. So I want to put out right away, when we ask the question, does acupuncture work, we have, when we try to apply, the standards of evidence, the acceptable evidence that we show in our pyramid of evidence shown on the right, we immediately run into the issue of how you can blind or not blind a study. And a lot of this has to do with the fact that you're sticking needles into the patient, and that patient, whether it be a human or an animal, is certainly going to know that there is a needle being placed there, so they know they're being observed and assessed. And that's what we call the Hawthorne effect. That makes it possibly that there be more of a positive outcome for a study. When we look at the placebo effect, issues of, is it acupuncture where the needle's put in a place that is supposedly supposed to stimulate the area, or is it in a pseudo area, or no stimulation at all if it's electroacupuncture? The advocates of complementary and alternative medicine and traditional Chinese medicine believe that if we apply the standards of placebo against acupuncture, it provides too restrictive a standard. And in fact, we know that in this scenario with acupuncture, that's the placebo responders may be in the range of 30 to 60%. Now this is high, but we also have, depending on how a study is done, we can have a similar outcome for many psychiatric and behavioral studies with drugs. And then, we have the issue of, well, there are just some that don't respond, and maybe the use of acupuncture wasn't appropriate. And if you remember from one of the first units, we talk about acupuncture being focused to creating normalcy from something that's out of balance in the body. So if it's applied to essentially address a certain issue, and that issue really doesn't exist, then you may not see an effect. There's always the issue of the healing effect that is, and we know we see this in veterinary medicine too, the patient-physician, patient-veterinarian interaction itself, or might be the owner's interaction with the patient. This has got a healing effect to it, and we know that this can apply to animals as well. So the problem, finally, is that complementary and alternative medicine therapies frequently rely on diagnostic and therapeutic methods that are unique to this particular format. So they're using the standards of acupuncture. They're difficult to kind of relate some of those standards to Western medicine. And so I wanted to put all this out front in order for us to then take a look at the evidence, and in this case, applied in the Western sense towards acupuncture and towards finding a real effect as we go through the remainder of this presentation. So in 2015, Juan did a study that was a meta-analysis, and he evaluated the tendency for bias, which I think is ultimately the most difficult thing to control for with acupuncture, and rated these according to low, unclear, or high risk. And so you can see that, and actually it's pretty surprising that as we look at concealment, for example, allocation, selection bias, blinding, that actually his assessment was that there's a low risk of bias from this perspective, where I guess for my thinking about it ahead of time, you would think that there was a much greater risk, a higher risk. The outcome assessment is also difficult to blind, and I think he acknowledges that with this much more uncertain or unclear risk of bias. And so as long as we recognize, and this is true for any study, whether it be acupuncture or others, that there's a risk of bias, and that bias tends to be increased when there's an inability to blind or randomly assign patients, then we'll be able to interpret the results a little bit better. So to look completely at what Juan did in this study, and he was focusing on local and distant acupuncture points for chronic musculoskeletal pain. So this was a systematic review, and a systematic review was addressed through identifying studies in a database, and he ended up with, after removing duplicates, 3,105 studies. But as you go through this and look for full text evidence, evidence in full text, also studies including qualitative analysis, and removed studies that were not randomly controlled, not too old, et cetera, they end up with 15. Now 15 is around 0.5%. So 1 out of 200 of these cases or these studies of acupuncture in the literature, 1 out of 200 were considered to be of adequate detail and quality to be able to be considered for assessment in his study. And so I think that right away shows the real difficulty of applying Western evidence-based medicine techniques to acupuncture. So by way of summary, and again, Juan was looking at the effects of local acupuncture that is close to a site of pain versus a control, or distal, meaning distant from it, versus a control. And he found, and just to give you to orient you to this, anything where you see the error bars, for example here, being on either side of the line, would suggest that the evidence would support, or the statistics would support, in that case, if it's to the left, experimental; if it's to the right, it's control. So you can see that when you look at the local acupuncture point versus a control, this is a significant finding, as summarized right here, and all the individual studies are above it. If you start to look at whether there's a difference between the distal or distant acupuncture point versus the control, this was not significant, as summarized here, and overall it was significant, but look at how significant. So we're talking about something that is just below, just in the favor of the experimental situation, and largely due to the fact that local administration of needling, needles to, say, a point of pain, are more likely to show positive effects for managing that pain. In another study, Madsen et al. In 2009 did a systematic review of randomized clinical trials with acupuncture, placebo acupuncture, and no acupuncture. So obviously, acupuncture means a specific site that is part of traditional Chinese medicine. Placebo acupuncture is some random site, and no acupuncture is obviously no needle at all. And so here, if you take a look at these, in this particular graph, we're just looking at acupuncture on the left or placebo acupuncture. You can see it's a very mild effect, minus 0.17. It is technically significant to the left, suggesting that it favors acupuncture. So the effects of acupuncture, if you look across all of these studies, would be, and there are some studies where there are no significances, but putting them all together, there's a mild effect, a very small effect. And I think one of the messages you could see from this is that there may be some experimental paradigms where, in fact, acupuncture looks pretty good because of the way they set the study up, whereas in others, that it's not so good. Even more interesting from this study is the fact that where this study looked at placebo acupuncture versus no acupuncture, there was an even more significant effect. What does that mean? That means that putting in the needle has an effect. And since these were human patients, the effect, as you can imagine, is a pretty good index of their, that it's the administration or the process that has a positive effect in terms of interpretation. This effect is even greater than the effect, if we go back to the previous image, of the actual acupuncture versus the placebo. So the placebo acupuncture process suggests that there's an effect, that there's some effect, and that much of the benefit of acupuncture may be tied up in the placebo effect. So to summarize this particular study, and I thought it was useful just to take directly from the review panel in that paper. First of all, as we've pointed out earlier, acupuncture is commonly used for treatment of pain. It involves close patient-provider interaction with suggestive components, and that's probably where the concern is over the placebo effect. And it's very difficult to blind the patients. And in our case, probably difficult to blind animal patients as well. So this particular study confirms that the analgesic effect is small and really cannot be distinguished from bias resulting from incomplete blinding. And so I didn't go into that in the slide before, but that's the issue of the blinding. How do you blind for an effect that is basically an injection or a use of a needle? The analgesic effect is moderate and variable. So some studies have big effects, others have small effects or none. And it seems to be that the effect of acupuncture is unrelated to the type of placebo acupuncture used as control. So, in one of the most commonly used areas of acupuncture, management of pain, these are the kinds of data that one gets from a systematic review. And you can see that it's not overwhelmingly positive, but I think that but that doesn't mean that it's the application of acupuncture in the process, particularly if looked at in the context of, well, what are the adverse effects of this? If there's a positive placebo effect, maybe that's a very significant component of the therapy. So I thought I'd take a look at another study that actually went into very specific indications of acupuncture, also a meta-analysis review by Cheng, and wanted to look at some that had strong evidence and some not so strong evidence. So what about managing nausea and vomiting? And so a particular site, PC6, for acupuncture leads to stimulation of areas that are associated with autonomic regulation of vestibular function. Okay. And in addition, there's a reflex associated with improved gastric emptying through increased vagal activity. So from the Western perspective, those two mechanisms may indeed lead to reduced tendency to vomit. This is actually not a common application, but there's pretty strong evidence that by using this acupuncture point, you can manage nausea and vomiting. In fact, this is occasionally used for instance, chemotherapy, adjunct therapy. So, because of the nausea. Here's an example of a very positive, a strong effect based on Western medicine, and even a mechanism whereby stimulation of the autonomic nervous system by acupuncture can show an effect. What about gastritis? Also putatively something that's going to be involving the autonomic nervous system. And so the acupuncture points for this are chosen through indirect stimulation of a nerve, and in theory the proposed mechanism of action is improvement of local blood flow. We talked about that in previous modules, and indirect stimulation of an affected nerve. This assessment was that the evidence for efficacy is equivocal and the mechanism is not well established. There are other areas relative to gastritis that suggested that there's increased gastric emptying through increased vagal activity. We mentioned that with vomiting. But in this case, for gastritis, the evidence is lacking. And so it's lacking in people, but important to us, the mechanism is reasonably established in animal studies, but it just lacks human clinical data. So probably we can say that if this study was to be done in veterinary medicine, we would see a more positive tendency for positive results on this meta-analysis. Now, in the second unit, I addressed as one of the examples of autonomic function being affected by the acupuncture, I addressed the possibility of managing blood pressure. And indeed, certain sites that stimulate the sympathetic response, reflex, that are evolving the arcuate nucleus of the hypothalamus and various parts of medulla. And these are known to be associated with autonomic control of blood pressure. Now, the evidence for efficacy from this meta-analysis was lacking, but again, the issue was that it was, although the mechanism is reasonably well established in animal studies, that there's lack of data on the human side. So I think, again, if we were to do this study, this type of study in animals, there may be a more positive result, but there is no such study that I can refer to that I'm aware of. Finally, let's take a look at a pain scenario, managing lower back pain, which is a common problem in humans as they age particularly. And in this case, the reason for choosing acupuncture were the location of affected muscles in the lower back. The proposed mechanism of action is that the micro-injury through needle insertion stimulates axonal reflexes, and as we mentioned in the third unit, this can lead to interruption of the pain pathway and also have other effects on relaxation of the muscles. The evidence for this is very positive, and this is, as a result, a very popular application of acupuncture. The mechanism is reasonably well understood. which is a neural mechanism that is associated with activation, as we showed, of the somatosensory areas of the brain, and so perception can be altered as well. So here's an example of systematic review indicating positive impact on this particular problem associated with pain. In this four-part series, I've used a number of references from current literature, tried to focus on those things that addressed autonomic and pain, and as well as evidence of more modern techniques such as functional MRI to evaluate acupuncture. This is not meant to be a complete analysis, but just to give you a feel for where acupuncture has come with regards to matching up against the kinds of evidence that Western medicine likes to apply to any therapeutic procedure.